Welcome to the LactaWebinar on breastfeeding challenges for working mothers and their families in different workplace settings. My name is Kathrin Litwan, and it's my sincere pleasure to guide you through the next 2 hours. Before we start, I would like to quickly go through our housekeeping. If you cannot hear or see us, please check your computer preferences, close other programs, and check your sound level. If issues persist, you might need to close and restart the Zoom meeting or join via the Global Health Network's Facebook page. Your camera is automatically deactivated and all microphones are on mute. If you're joining us on Zoom, please ask your questions in the non-public Q&A section that you find on your toolbar in your Zoom window. We will answer as many questions as possible during the webinar Q&A session. In the spirit of open access and knowledge sharing, we are recording this webinar to make it accessible for a wider audience on LactaHub, included the slide deck. And lastly, LactaHub issues certificates of attendance upon request, and it can be issued after full participation. We will share the details at the end of the LactaWebinar. I'm very thrilled now to welcome our experts, and especially Dr. Alice Lakati from Amref International University, who chairs today's LactaWebinar. Thank you very much. Josephine Munene from the Kenyan Association from Breastfeeding, Gabrielle Sauini from the Brazilian Association for Parents, Families, Friends, and Caregivers of Preterm Babies, as well as Dr. Oscar Rojas from MABE, will be our experts today. And again, my name is Kathrin Litwan. I'm a doctoral candidate at the Yale School of Public Health in the USA. You find all full bios on the LactaHub.org/LactaWebinar website. We are moving along and a short outlook on our next 2 hours. I will give a short introduction to the topic of today. Josephine Munene will follow and give us insights from her experience in Kenya. After a short break, Gabrielle Sauini will speak about breastfeeding challenges in Brazil, and Dr. Oscar Rojas will tell us from MABE's experience in Mexico protecting mothers at the workplace. We will wrap up our webinar with a Q&A session for which you're invited to send us your question to the Q&A feature on Zoom or on the Facebook page. Moving along, it's now my sincere pleasure and honor to hand over to Dr. Alice Lakati.
Good morning, good afternoon, good evening to colleagues and from different parts of the world. We are really honored that you have had time to join us today. Thank you so much, Katrina, for the kind introduction that you have given. So colleagues, we are excited to be here today to join the rest of the world as we mark the World Breastfeeding Week. I recognize many colleagues from across the world. I recognize colleagues from Kenya and different parts of Africa as well. I want actually to acknowledge the presence of Professor Colin Beans from Pais. I know it's late for you. Thank you all for joining. So I'm going to start this session by inviting us to reflect on the theme of this year World Breastfeeding Week. Colleagues, we join the rest of the world in celebrating and marking the World Breastfeeding Week And the theme for this year is let us make breastfeeding and work. It's important for us to reflect on this because work is important for all of us, but also even think about all the working mothers, irrespective of whether you're in employment. WHO has documented, and a lot of research has confirmed this, that breast milk is the best and the most sure way of ensuring child survival. And coming from sub-Saharan Africa, this is probably the most effective way of ensuring a child survival. Despite this well-documented benefit of breastfeeding, it's just sad to know that today we still have 500 million working women who are not given essential maternity leave. We also know that from the statistics provided to us by WHO is just that just 20% of the countries require employers to provide employees with paid breaks and facilities for expressing breast milk. This is actually a luxury in most of our settings. And we know that fewer than half of our infants are exclusively breastfed. So the objectives for this World Breastfeeding Week are 4 of them. And looking at what is on your screen, we want to look at how we can really make breastfeeding work by informing people about the perspectives of breastfeeding and parenting. We also want to look at how we can anchor by ensuring that there is optimal paid maternity leave. We want to be able to engage with individuals and organizations to ensure support of breastfeeding, and importantly, galvanize action to improve conditions relevant to promoting breastfeeding at work. So colleagues, let's join the world in discussing this today. And you can go to the next slide. I work for an organization called Amref International University, which is an academic institution. Amref International University affirms its commitment to supporting breastfeeding, but importantly, as a training institution that is founded from an NGO that has been implementing health programs in Africa for over 65 years. We are actually committed to developing solutions for solving African problems. We are focused on education in health sciences and actually driving affordable access to health sciences training in Africa, because we know that we cannot solve the challenges of human resources for health in our setting if we don't provide opportunities to people from marginalized community to access health sciences education. So as a university, we are committed to this. So our university, or my institution that has actually partnered with Lactation Hub and the Global Health Network to run this webinar, because we believe that primary healthcare is the biggest, is actually the best way to provide healthcare to majority of the people. So we have purpose and committed ourselves to train health workers for the primary healthcare systems in Africa. And as a university, we are focusing on 4 strategic objectives. The first objective is developing fit-for-purpose leaders for the primary healthcare systems in Africa. We want to provide a training ecosystem that promotes equitable access to health sciences education. We want to be able to drive evidence that will advise primary healthcare systems in Africa, because we believe that actually primary healthcare systems in Africa are not advised by local evidence. And finally, our university is focused on bridging the gap between knowledge and practice. Our first step in promoting primary healthcare for sub-Saharan Africa and Africa in general, this year we are hosting our first primary healthcare congress, whereby we want to interrogate on whether our primary healthcare systems in Africa are advised by evidence. So I'm inviting us to join us as we interrogate this on 29th November to 1st December 2023 here in Nairobi, whereby we shall interrogate the theme of aligning evidence, aligning practice to evidence in strengthening primary healthcare for lasting health change in Africa. And therefore, this week whereby we are looking at supporting breastfeeding, it speaks very well to what we are doing as the larger Amref, that is Amref Health Africa, and the university. So I'm inviting you to this Congress. So this Congress, we have partnered with a number of institutions. The Global Health Network that we are working today to host this webinar, Lactation Hub, and those of you from Kenya recognize some of those logos, but I want to talk about, to really recognize Nairobi County that is working with us, African Population Health Research Center, Jaramogi Oginga Odinga University of Science and Technology, Health Rights, an organization that is called the community, that actually works with community health workers. So that is the team that is working on this Congress, and I'm inviting you to partner with us as we meet in Nairobi this year. As I come towards the end of my first part of the talk, as a training institution, I want to highlight the importance of training institutions in promoting breastfeeding. Training institutions really play an important role because this is where we shape future health workers who would be able to support breastfeeding. And therefore, training institutions have an important role in training health workers such that we are going to qualify health workers who have the knowledge and skills. They also have a role to strengthen curriculums, because we know that from many of our training institutions, breastfeeding is covered as a very small topic. And therefore, training institutions have a responsibility to strengthen the curriculum and really to ensure that we are able to train health workers who have the competencies to address challenges faced by breastfeeding mothers. We are also able to have a pool of health workers who will support breastfeeding at facility level, at individual level, at community level, and at national level. And importantly, there is a lot that is known about breastfeeding. Training institutions have a role in supporting research for breastfeeding to provide evidence. And I've talked about local evidence for different settings. Today, we are going to listen to speakers from different settings. Every setting is different. And of course, finally, lobby for policies. So I invite all of us as we engage in this conversation today of making breastfeeding and work. I hand over back to the moderator to take us to the next session. Thank you very much and welcome again.
Thank you, Alice, for this very kind and interesting introduction. And once again, thank you for sharing our webinar today. It's now my pleasure to give you a short overview why workplace lactation support programs can be so powerful. Supporting working moms globally has a huge potential to support roughly about 2 billion children by just providing support at the workplace. Starting with roughly 8 billion people in the world, we find that about 22% of the female population is in reproductive age and is economically active. This means if we take a fertility rate of about 2.3 births per woman, that we reach about 2 billion children by providing lactation support at the workplace. Thus, we can say that providing workplace lactation support has the potential to improve global breastfeeding rates. Up to today, many mothers are struggling to meet the WHO and UNICEF breastfeeding recommendation, and working mothers face even bigger barriers as return to work is associated with lower rates of exclusive and continued breastfeeding rates. But what are those challenges? One of those challenges is the different timeline of the WHO and UNICEF breastfeeding recommendation and the recommendation for maternity protection by the International Labour Organization, or shortly ILO. While the WHO and UNICEF recommends to initiate breastfeeding within 1 hour after birth and exclusively breastfeed for the first 6 months of an infant's life, the International Labour Organization asks their member states to provide 14 weeks of paid maternity leave. After this time, the employers are asked to provide daily breaks or a reduction of work time to breastfeed the child to help to allow to follow the WHO and UNICEF recommendations. But how should real-life workplace lactation support look like to be successful? While it is clear that working mothers should have access to space and time to lactate during her working time, there is no one-size-fits-all solution in place that is successful for all women. The success of every intervention depends on the context in which it is implemented. Besides the context, mechanisms such as the awareness and usage of the intervention among the working mothers, as well as the existing culture within the workplace, determines the success of an intervention. And with this, I'm now curious to hear from our experts from around the world how successful workplace lactation can support working mothers in their settings. It's now Josephine Munene from the Kenyan Association for Breastfeeding who will make the start with the experience from Kenya.
Thank you. My name is Josephine Munene from Kenya. I'm a maternal, infant, and child health specialist and a lactation support professional. I'm going to talk today about the multifaceted approach to maintaining exclusive breastfeeding for the recommended duration among working women in Kenya. So this is an overview of my presentation. I'm going to go through the data, the most recent data from the survey that took place in 2019. And then I'm going to go through the legal and regulatory frameworks for working mothers, the factors that affect the duration, and this is going to be both enabling factors and the barriers, and then what the recommendations are. As you can see there from the image in this slide, breastfeeding and work is not unique. This is a photo from an image from very many years ago. It's a traditional woman, a Kikuyu woman, coming from the field presumably coming from the field, but she's carrying her baby and her baby is breastfeeding. So the idea of a mother being able to multitask is not new, but what has changed is the environment in which the mother is working and the fact that there now has to be separation. So what can we then make sure, especially in the local context of Kenya, to make sure that all mothers are supported legally, mentally, emotionally, so that they make sure that they meet their goals and that we have a healthy nation. So this is the most recent data from the KDHS, the Kenya Demographic Health Survey 2022. So what we know is that 52% of women are currently employed compared to 77%, but at least half the women between 15 and 49 years right now are in the workforce. Most of these women are paid in cash. What does that mean? That means that they have more liquidity, they have more independence. So the cash-only aspect of their pay is also very important in how they're able to make decisions. It's also empowering. And we can see here that the number of women who have been paid cash has increased since 2003, so the last 20 years, from 55% to 79%. Because you can also classify work as people who are doing unpaid work and paid work. So this is paid work that is in cash. When we look at married couples, most of them are dual earners. 67%, 7 out of 10 women who are married are in the workforce. However, there are gaps and the gaps are substantial. So with the men and the women working in the same occupation, men are still being paid 30% more than women, and at least 7 out of 10 women are earning less. So again, the earning power is less for women. The gender wage gap is huge, but so is the labor force participation gap. As you can see from the figure 6 on your right, the number of women who go into the workforce increases with each child, but the increase for women is less than the increase for men. So if you see with both couples who do not have a child, 27% of women are at home, but once they get a child, start getting children, 60% go back into the labor force, but even more men go join the labor force. And the number of men who stay in the labor force is almost consistent, between 96 and 95. But the number of women in the labor force changes. So again, that is affected by them giving birth, which means women are still having to make a choice between, should I stay at home and take care of my child, or do I have to leave, or do I have to go back to work? Do I have to stay at home? But for men, they do not have this issue. So this is very telling data in terms of the support and the opportunities that women have or don't have when they go back to work. Now, decision-making and bargaining power for currently married women is higher for those who earn cash. This indicator lets us know that, again, when I talked about the importance of earning cash, it's more liquidity. There's more empowerment because a woman is able to also make infant feeding decisions. A woman who has cash in hand is able to decide, can she then hire somebody to help her with the caregiving of the child and go back to work? Is she able to buy the equipment that she needs to express milk in the office? So that being able to earn in cash and not having to wait, for instance, at the end of the month, or being paid in kind, for instance, if she's working in agriculture and she's paid in terms of food instead of cash, will reduce the decision-making that she has, whether it's in the home or around her, and also her health. It's also important to understand the occupational status of women in Kenya at the moment. So as we can see, interestingly enough, in every single occupation, we have, apart from a few such as the plant and machinery, but in most occupations, women are predominant, almost the same as the men. But the telling thing is that most women are employed in agriculture and elementary occupations. These elementary occupations are the ones that we can call casual laborers, probably paid at the end of the day. In Kenya, we would call them the mama fuas, the ones who go to the marketplace, the ones who sell on the streets. So if you have most of your population, your working population, working in sectors that are not that well regulated, then you also find that these women might not have the disposable income that they also need to make decisions when it comes to infant feeding and childcare as well. So as we can see, these numbers are going to now relate to why support needs to be tailored, why workplace support cannot be a one-size-fits-all, because that workplace is also very different from each woman. So it has to be very tailored. It has to be cognizant of what does she have available, what can she use to express, store, how does she have access to her baby during her work time. So this is why it's important to understand the number of women who are working in the different occupations, because it then determines the decisions we make on the interventions that we use. Now, these are the most, for me, exciting indicators. So here we have infant feeding practices 0 to 5 months. So over the last 20 years, we've seen an increase in exclusive breastfeeding from 13% in 2003 to 60% in 2022. The problem is that between 2014 and 2022, the indicator has not changed from 60%. It is still higher than the global indicator, than the global rate, but given all the work that has been done in the maternal, infant, and young child feeding space, nutrition space, we should have definitely seen a significant increase in the last few years. And hopefully it's easy to now be able to make the correlation between the fact that women have been earning more over the same period of time. They've been earning more cash. The number of women in the workforce is increasing. So you can say that the correlation between the increase in working women and exclusive breastfeeding rates not moving shows a negative correlation. So again, a call for workplace support is supported by the data. So as you can see, 77% of children, so 7 out of 10 children, infants, are exclusively breastfed for the first 1 month. But what happens at 4 to 5 months, that rate falls. And there's a lot of introduction of other foods, so there's mixed feeding. But those are the months that most parents also go back to work. And also you can see that the percentage of babies who are exclusively breastfed by the women in the lowest wealth quintile is also lower. Those are the people who I was saying are working in agriculture, they're working in the elementary occupations. So it makes sense that when they go back to work, they do not have the provisions that allow them to continue exclusively breastfeeding. But in addition to this, women need to know and understand why they're breastfeeding. So there's a lot of messaging out there, breastfeed for 6 months exclusively, but without the support to do that, then you're not able to reinforce those messages. Mothers need to be shown how to place the baby on the breast. They need to be shown how to express. The caregivers who are left with the babies need to be shown the same thing. So here the data shows us that in ANC, antenatally, 81% of women were counseled about breastfeeding. But of those ones, the data goes further and tells us that a very small percentage, about 40%, went for all 4 visits. And the ideal is 8 visits, and only 4% in Kenya, in the Kenyan data, went for 8 visits. So we have 81% who are counseled altogether, but a very, very small number goes for enough sessions to be able to get meaningful support. And the most telling indicator is that 25% of women, only 25% of women are getting counseling after birth. So this is in the community. So clearly there's a breakdown in the continuum of care when it comes to infant and young child feeding practices. So in Kenya, we are lucky enough to have legal frameworks for working mothers. We have the Employment Act, Section 29, which provides 3 months, but also job protection. Then we have the Health Act of 2017. And for the Health Act, it also applies to paternity leave of 2 weeks for fathers, although that could also be a lot longer. Then we have the Health Act of 2017, 2 sections, 71 and 72, that ask for or compel employers to establish dedicated spaces with the necessary facilities for working mothers to be able to either breastfeed on site or express their milk. And it also comes with protected time. Protected time means that a mother doesn't have to worry about working extra hours to make up for the time she has used to express. So protected time has to come hand in hand with the workplace. And then we also have the guidelines by the Ministry of Health, which are very clear. It is a document that is very clear. It has everything outlined on why we need breastfeeding-friendly environments, how you can achieve these environments, how you can monitor and evaluate the impact of this. So For us in Kenya, we have truly taken strides to make sure that at least employers out there are well guided and there's some level of social protection for mothers. And then we have the Breast Milk Substitutes Act 2012 and also the regulations of 2021, which control how breastfeeding, breast milk substitutes such as infant formula or designated products such as bottles and teats are regulated in terms of marketing, because all these companies who produce the breast milk substitutes have very huge marketing budgets. For us, breastfeeding is a public health issue. So the only marketing we can do, the best marketing that we can do right now is first to make sure that the competition is not as visible, but also we have to keep promoting and protecting and supporting breastfeeding. That is the only way that we're going to make sure that breast milk substitutes do not win out. Then we have the Breastfeeding Mothers Bill of 2019. It's still a bill, it hasn't been enacted, but the idea behind it was to provide a legal framework for breastfeeding mothers because of the gaps that are in the provisions of the Health Act 2017, which I'm going to discuss in the next slide. So what are the factors that are affecting duration? Why aren't these mothers not able to go beyond even 77% when they initiate? And why are the numbers at 4 months so low, where you only have 4 out of 10 children at babies at 4 months being exclusively breastfed with a 2-month gap failure rate? So when we talk about the Employment Act, it focuses, and also the Health Act, they focus a lot on a specific group of employees. Employees where the assumption is that they're working in a formal premises, that they have protection when it comes to paid maternity leave. Because again, if we talk about the women working in agriculture, the women working in elementary occupations, even our own domestic workers, whoever here has a domestic worker, if you have a domestic worker and they go and leave maternity leave, are you still paying? The majority are not. Majority of them are not paid. They tend to go on maternity leave and then they find that their job has gone. So there's very little job protection for the people who are not working in an office or are on full-time contracts and formal contracts. Now, for those people who are not well protected by their workplace, neither are there government cash transfers or social assistance for parents, where if you're unemployed or if you're in formal employment, you should be able to at least have access to some payment until you find a job. Another thing, another gap with the legislation is the lack of standardized legal frameworks within which childcare daycare facilities can operate. So right now, most of the daycare facilities that are in urban informal settings are just in someone's house. So you find that one lady sets up a house, probably gets something about 50 shillings, 50 cents, definitely less than $1 a day. There's no regulation, there's no health and safety. And even though there is a provision in the Constitution, you find that because it is left to the county governments to interpret what that is, we still don't have standardized acts, which is very, very important. We don't have standardized frameworks when it comes to childcare. With the health system, ineffective infant and young child feeding counseling and inconsistent messaging. As shown before in the indicators, only 25% of women are getting this information. Why? What is happening? Because we do have the health facilities. We do have the nutritionists. So why is it that this information is not getting out there? What is that gap in our healthcare system? Again, continuum of care. Most of these mothers are in the hospital for about 2 days, mostly 12 hours. So if that is a primary space where they're going to get information, then it is not enough time. There has to be a handover from the health facility into the community. Also limited, in-depth, tailored postpartum breastfeeding counseling. So for instance, for me, I'm a lactation support professional, but most of the time others have to look for me. And it's right now, it's a very niche profession, but we see how much care is needed. Mothers should not have to look for help. It should always be available. Households. What is happening in our community that is not allowing for this support to be there? So we have cultural beliefs. We have to make sure that the cultural practices are not barriers. Lack of basic amenities and infrastructure. Piped water. When we talk about safely expressing and storing milk, even at home. Limited availability of childcare at home. If both parents are working, as we said, they're dual earners. So if both parents are working, then who is going to be looking after this child? If they're not earning enough, are they able to pay for childcare? No, they're not. Workplace support and supportive organizational cultures. Breastfeeding is left to a mother. If you're a female employee, it's very unlikely if you work in a male-dominated industry that you're going to get the support and understanding, because there's also a lot of lack of information and awareness about why am I supporting this female employee to breastfeed and not understanding the impact it has on her, her children, her family, but the community and the business. There's a very strong business case for having workplace support. Child daycare facilities. A mother might be able to express, she might leave her milk at the daycare facility, but because of lack of information, biases, the managers and the staff at the daycare facility will not give the baby the expressed breast milk, and they'll prefer to give the baby porridge, even if that baby is 3 months. So there's a lot that needs to be done. The recommendations. So these recommendations are in line with the studies that have been done. Very many studies have been done. Dr. Lakati herself has written papers, and especially in this area. So the studies are there, the findings are there, the KDHS data is there. So why do we still have this gap? What can be done to close the gap by all of us, starting with legislation? Enforcement of the provisions, they have to be enforced. They have to be compelled. Employers in all sectors, and regardless of the contracts in which they're giving their workers, it has to be there. So for instance, pushing through the Breastfeeding Mothers Bill, supporting it in whichever way that we can do that. Enhancing the services and amenities provided by county governments. So for instance, the county, the Rakanibi, has lactation space and creche in its open marketplace. More counties to take that up, because here in Kenya, health is a devolved department, so it's devolved. So it means that the counties need to take up more of this. So we can't just leave it to formal workplaces and employers. Tertiary education institutions, universities, colleges, they also need to be part of this, because the data also showed that the median age of giving birth, the first child, is 20 years. Most of these people are in college, they're in university. Are those provisions there as well? So we really need to be clear about, when we talk about workplace support and who this law applies to, it is anybody and everybody who works or is an employer. When it comes to the healthcare system, the baby-friendly hospital initiative to strengthen that, so that the 10 steps to successful breastfeeding are well and clearly, first of all, very well known, but also very well implemented, both in public and private health facilities. It should be a blanket recommendation and ensurety that all health facilities are BFHI accredited. Baby-friendly community initiative, an amazing initiative that is here in Kenya, where we have people living in the community who are skilled, or rather who are upskilled and taught and given the knowledge they need to be able to support their community members. But now to upskill them, community health promoters, so that they're able to conduct home visits, but also most importantly, tailored counseling in the home for the mother. Clear linkages. When this community health promoter finds an issue, they should be able to refer that person to the next, if it's an advanced issue, a lactation management issue, there should be a clear referral linkage. Structuring of mother-to-mother support groups, very important to address cultural practices. And then combining these messages that we're talking about, breastfeed exclusively for 6 months, but combine that with the how. You know, how do I do this? Because that's the only way we are going to reduce the influence of breast milk marketing, breast milk substitutes. At the workplace, create breastfeeding friendly policies, but also taking in account the fathers. We are focusing a lot on the mothers, but like I said, they are dual earners and dual carers. So give that father, compel that father to take his 2 weeks, but also allow for remote working of fathers, so that they can help at the house as well. If they want to, which they will, because they also want a healthy child. They don't want to keep taking leave and having to pay extra for healthcare. Improving access to necessary equipment and supplies. So in addition to the room pumps, give subsidize. There are companies in Kenya that are selling pumps that can be multi-user pumps. Normalize expressing and storage by training peers, because sometimes mothers go back to work, they try to express, they try to put the milk in the fridge. It's like, oh, you can't mix your milk with my lunch tin. So just telling people there's nothing communicable in breast milk if you put it in a container next to someone else's container. So a lot of education on that. And also private-public partnerships on childcare access. So I had the privilege of going to Sauini Tea Estate, where they're working with the county in Nandi. So it's a tea farm, and together with the county, they have a nursing unit, as you can see in that picture, but they also have a dispensary, and they have a nutritionist and a nurse every so often. So those kind of partnerships that bring access closer to the mother. And then for the daycare facilities, a harmonized legislation. Right now we have an act in Nairobi County, then we have a different one in Mombasa, and they are there, but they are not harmonized. And then skills building of daycare managers. Again, coming together as a team and saying, okay, this is a health facility in this area. We are going to work with these daycare managers to upskill them. And county subsidies, so that they can be able, these daycare managers can be able to get access to financing so that they can also improve the facilities themselves, but also the equipment that they have. Thank you.
Thank you, Josephine. Thank you. Thank you for your very insightful comments from Kenya and all the recommendations that you attached to it. Just a short reminder to all our participants today, please send us your questions that you have about Josephine's talk or the previous talks to the Q&A feature in your toolbar at the lower end of your Zoom window or through the Facebook page. I'm now looking very much forward to hear from Gabrielle Sauini about her experience in Brazil. Gabrielle is from the Brazilian Association for Parents, Families, Friends, and Caregivers of Premature Babies. Gabrielle, I'm handing over to you.
Hello, good morning, everyone. It's a great pleasure to be here with you today. I'm a Brazilian speech-language pathologist and children's health specialist, and I'm here representing Prematuridade.com Association. That's a Brazilian non-governmental organization that works to decrease premature birth rates and to protect the rights of the infants and their families. And breastfeeding is being one of our primary focus. I'm here to give you a brief overview of breastfeeding challenges in Brazil for working mothers. So let's start talking about the existing laws and benefits in Brazil. Now we have 120 days of paid maternity leave for both rural and urban women, and 5 consecutive days for fathers. And in both cases, it happens without salary loss. When the mothers return to work, they have 1 hour per day available to breastfeeding during the work period until the 6th month, and it can be divided into 2 breaks of 30 minutes each. Mothers also cannot be fired until 180 days after delivery, which means only 2 months after return from maternity leave. The government has created a program to encourage companies to give more time for mothers and fathers of paid leave and get tax rebates. The proposal of this is to achieve 6 months of maternity leave and give 15 more days for fathers. However, in 2021, only 1% of Brazilian companies have joined this program. This same program aims to implement breastfeeding support rooms at the workplace too. But only a few companies have them now, but this number is improving, not only at companies, but in airports, in malls, and other public places. Another benefit is having daycare centers inside the companies, but they are really rare to find, which is a pity because it's a really good thing for mothers and babies. These graphs show 2 important data about the average of exclusive breastfeeding in Brazil. One is the gap between rural and urban populations, and the other is about the decline of exclusive breastfeeding rates over the months. Focusing first on the rural and urban disparities, we can see the gap since the first months of breastfeeding, but in the fourth and fifth months, the difference becomes more pronounced, and less than 8% continue breastfeeding exclusively. Now, about the changes over the months, we can see that at 4 months and exactly when maternity leave finishes, there is a significant decline of exclusive breastfeeding rates, and only 23% can continue breastfeeding exclusively. So here we need to see and to think about public policies focusing on equity between rural and urban populations and laws that really protect breastfeeding. So now, in addition to the challenges already presented, there are some more topics to consider about the Brazilian scenario of breastfeeding. In Brazil, we have 90 million women in formal jobs. The laws that I have mentioned before does not include them because they are informal workers. And this data represents 43% of the Brazilian women population. That's a lot. We need to look at those women. In this number, we can, they represent rural workers, farmers, housekeepers, hairdressers, among others. We also have in Brazil some economical issues, and the women are more affected than men. Brazil, as you know, is a developing country, and women receive 21% less than men. Their salaries on average are the equivalent of 2 minimum wage, and it's important to highlight here that the minimum wage in Brazil is outdated. It does not reflect reality. So it's not unusual to see women in double shifts. Now I'm asking you, how can a mother balance double shifts with exclusive breastfeeding, or balance double shifts with motherhood in general? Regarding the home office, at first glance, it seems good for mothers. It gives them more flexibility, more time to stay with the baby, more conditions for breastfeeding. But we are seeing mothers reporting that the companies are questioning the need for maternity leave during remote work and requesting them to do a few tasks in this period. It cannot happen. Breastfeeding is so delicate, not only in Brazil, but in the whole world, because it comes against industry interests, that if we do not be alert, we will lose rights that costed us decades to conquer. Some examples of this can be noticed in those recent law changes. Now in Brazil, when the mothers have 6 months of maternity leave, it's possible to share it the last 60 days with the baby's father. The justification is to share the child's responsibilities with the father, and well, of course we agree with that, but not this way, not putting in risk the continuity of breastfeeding in a period that it should be happening exclusively. The other change is to give mothers 8 months of maternity leave since they return to work part-time after 4 months. And I wrote here maternity leave because it's exactly the way the law refers to it, but it shouldn't. The mothers here are losing 2 months of their maternity leave. It might work for some mothers, but again, we do not want to lose rights we have conquered. For people living in big centers and with low income, for example, they often live far from their job and depending on buses and trains for transportation. The time for a part-time job added to the transportation time might be time enough to put breastfeeding risk. Stored milk in this period might be lost on the way home, for example. So I hope until now it's understandable that we need to think about public policies that really protect breastfeeding. Well, we have a lot of issues needing attention, and we can never stop pressing governments for public policies. But what we can do to improve what we already have? How can we support breastfeeding at our workplace? Simple changes can be helpful to working mothers. To help with that, I've created an acrostic based on simple changes that worked in my practice and may work in different places too. I bring here that we need to light up breastfeeding in our workplace. The L means that we need to listen to the women and mothers of our workplace. They are the best people to identify what needs attention specifically for their company and what changes should be useful based on their previous experiences. We can think about, for example, conducting personal interviews with them, implementing suggestion boxes, organizing collective meetings about the theme, etc. The I here means that while we are fighting for public policies and general changes in breastfeeding, we can focus on changing our workplace by making improvements in internal policies that consider breastfeeding and the needs of working mothers, making the return to work smoother. The G means that we can encourage groups of mothers at work. The mothers in these groups can share experiences, can create bonds, can help new and future mothers with tips such as finding a good place to pump or a better way to store milk. And besides that, it's easier to bring about change when a group is a group asking for it, not only one person. The H remembers us to think about the mothers who work from home. They also have necessities. They also need breaks. A full agenda may not work in the first few months after returning. They need their shift time to be respected. They need to separate work from maternity to perform well in both roles. The T means that we need to talk more about breastfeeding, raise awareness through campaigns, conduct lectures, bring in specialists, and involve all the staff in the discussion, women and men. The U remembers us to understand the mother's needs. Again, a full agenda may not work in the beginning. The breaks should be respected. The mother's performance at work might be different from before childbirth, and they should not be judged at any time or in any circumstance. And finally, the P means that we need to look for ways to implement breastfeeding support rooms or clean place where she can pump and store milk in privacy. I would like to briefly mention the expanded maternity leave for neonatal ICU patients in Brazil. Our association has been fighting for that since 2014, and finally in 2022, the Supreme Federal Court affirmed that the length of the hospital stay after delivery, whether it be for the mother or the child, must be included in the paid maternity leave after 14 days of hospitalization. That was a great victory because breastfeeding rates are low in premature babies, and in Brazil is the 10th country in the world ranking of prematurity. So this change is helping continued breastfeeding rates, is helping promoting a better bond between mother and baby, and it's facilitating a better development for premature and other NICU babies. So I would like to end my speech with this sentence that represents well what we are talking about. All mothers are working mothers. Motherhood requires responsibilities and is a continuing work. Sometimes it's added to a professional career that makes things even more challenging, but all mothers, even if they do not have a formal job, are working mothers, and we need to look for all women. Thank you very much.
Thank you, Gabrielle. I personally really like your light up framework, and I think it's very helpful moving on, supporting working mothers in reaching their infant feeding goals. As a reminder to all our participants, please send us your question for Gabrielle's talk, but also for Josephine's and Alice's talk to the Q&A feature in the Zoom toolbar or through the Facebook tool. It's now my pleasure to welcome Dr. Oscar Rojas from MABE, who will tell us from his experience in introducing an occupational maternity protection program at MABE. Oscar, it's now your turn.
Thank you. Hello, good morning to someone and good afternoon to others. It's a pleasure to be here with you, and many thanks for the family Larson Foundation for the invitation. Today I want to talk about the protection of breastfeeding and maternity in the workplace. It is a highly relevant issue, and it should be as important as any labor law, since the benefits for both the baby, the mother, and the companies that are huge. There are a lot of statistics in these regards, but very little is known by the general population. That is why these forms are important to make them known. This means that we still have a lot of work to do, but what has been done worldwide regarding for the promotion of breastfeeding in the workplace has been very good. I want to start with a phrase that I love to mention in the forums where I have had the opportunity to participate, which says, breastfeeding rights at work should be a conversation starter to better guarantee a positive experience during this stage in the life and well-being of working mothers and their children, as much as their communities and society as a whole. On the other hand, and in addition to all the benefits of breastfeeding, there are some others that are a little known about, highly relevant to further convince workplaces, promote breastfeeding in workplaces according to the International Labor Organization, that are decrease absenteeism of working mothers by up to 40%, since mobility in babies is reduced. Having breastfeeding spaces in the workplace decrease up to 35% the rotation of nursing mothers, and finally significantly improves commitment, the productivity, the engagement, that company becomes a value proposition and employee brand, among other indicators. So this slide is important because the lack of support in the workplaces is one of the leading causes where working mothers stop breastfeeding before the recommendation time. There are a lot of benefits about this, but the companies or the workplaces needs to know why it's important to promote the breastfeeding. In other way, have a different regulation by governments around the world on the right to breastfeeding. Sorry. For example, in Mexico, we have some regulations, health laws, federal laws, and even some international treaties on breastfeeding, but in really nothing is specific. We continue to seek to expand the benefits for mothers and the promotion of breastfeeding to ensure 6 months of exclusive breastfeeding. But we have in other countries that I don't know, as Canada or another ones who has more experience with these laws. It's important to be insist in these international studies because we need more information, we need more exposure around the world because the breastfeeding is an important issue. And finally, I will tell you that MABE is the company that I represent. It's a Mexican company dedicated to caring for the homes of the world with the manufacturing of electrical appliances and appliances in general, with more than 25,000 employees, with a presence in nearly 95 countries. We have a solid wellness and health program for employees, their families and their communities where we have presence. And among the experiences we offer to all our collaborators, specifically to the mothers, is in the part of the well-being, we have a medical follow-up, nutritional and psychological assessment, facilities that we have is standardized nursing rooms with international compliance. This is very important part of our program. And the benefits are that extend the maternity and paternity leave, no matter the country where we are, no matter the laws of the country. For the mothers, we have 6 months to promote the 6 months of breastfeeding exclusive. And we have another employee experience as a maternity kit that we give to all the mothers and fathers in the company, that are baby clothes, information manual, and a MABE teddy bear that is the most soft that we found. And we have a parenting school. Our next steps to promote all of these issues, and in specific the breastfeeding, we have building a new growth child center that is located in a place of, or in a site of our company in Mexico for 252 childs since 43 days of borns at 3 years. This side of our company has 8,000 of employees. So we are finding the best way to promote all the child care and the breastfeeding. There are some of our testimonials, mothers and fathers of our company who lives the experience. They have this manual to maternity and paternity orientation that we do for all our collaborators. That is for the parents who are going to live the experience for first time. This manual is for some recommendations about all the kit that you need for when your child is going to be born, and all the cares that you need to the baby, some clothes that you need to different kind of temporality, and another things that this manual has. We have the testimonials of our mothers and fathers. We do this not just for mothers, but not just for mothers, but most specific for mothers because of the breastfeeding. We try to be according to our laws, not just in Mexico, in any country that we have presence, but it's important for us to promote almost the 6 months of exclusive breastfeeding. And this is all the part of the experience. And in the other slide, we have some examples of our nursing rooms. We have different standards because we have different kind of sites. Ones of more than 5,000 people there, and another ones we have like 1,000, 1,000 or 2,000 of people. So we have different standards, but with the same facilities. And this is part of that I want to share with you. I have another slide with some other pictures that it's different nursing rooms in other places of our company. Not just in Mexico, we have a presence in different countries, as I said, in 95 countries, some with more people and other not much people, but we try to do the same for all. Thank you very much for the invitation.
Well, thank you, Oscar. It's so nice seeing all the effort Mabe has taken to support working parents. It was a really, really inspiring presentation. Thank you. You're still able to submit some question for Oscar and the other speakers through the Q&A tool. We will shortly start with the Q&A session, but before we do so, I would like to give you details about the certificate of attendance. To receive such a certificate of attendance, please visit www.lactahub.org/certificate and provide your personal information. You will be asked to answer the following 2 questions. Which information in our LactaHub webinar was most important to you? And did we miss it to discuss further aspects in today's webinar? If so, please let us know about which aspects you would have liked to learn more today. Your certificate will then be processed and issued within 2 weeks from the date of submission. And lastly, if you experience any troubles in submitting your question for a certificate, please contact LactaHub directly at contact@lactahub.org. We will now move on to our Q&A session. Thank you again for submitting all your interesting questions. You can still submit further questions to the Q&A feature or through the Q&A feature. And I would like to kick off this Q&A session with a question to Gabrielle. Gabrielle, how can primary healthcare workers support new breastfeeding mothers when they return to work?
I'm sorry, about premature?
No, in general, just primary healthcare workers, how can they support working mothers with breastfeeding and returning to work?
I think based on my practice, they can support mothers. First, listening to them, giving them space to share what is needed at the workplace for them. Sometimes simple changes, a few changes, do a lot of improvements at the workplace, and it would be very good for all mothers. The returning to work, it's a very delicate period for the women. So if we need to approximate the staff, the companies, the bosses from the workers to be more comfortable, to think about it, tell about it, to think together about changes at the workplace that should be useful for the mothers and should be something okay to the company do too. I don't know if I have answered, so please.
No, I think that was already very insightful. Thank you. Maybe a question to all of us, but I would like to start with Oscar from his experience at MABE, and it's a very practical question. Out of your experience, what is your advice to all working mothers? How can they talk about breastfeeding with their superior at work?
Well, we always try to give all the support to all the mothers in the company. So we have a follow-up medical science. We know that they are in this period of pregnancy. And in general, we have a big culture in the company to promote different aspects of well-being and health. And we think that the breastfeeding is a strong part of our program because it's the future of the humanity in an health aspect and in a well-being aspect. And this is a very specific topic when we talk about education and the grow up of the child of the world. So in MABE, we have a very strong program, not just for the mothers, in general for all the employees in the company. That is the culture, that is the to give all the tools to be better to be a better specialist in the things that you can do. And all these tools that are different programs and different kinds of formations that helps to all the people, it's that it's something that the company does very well. And we have experience on that. And we think this program of breastfeeding is part of that.
Great, thank you. Maybe Josephine, a follow-up question on that. Oscar just mentioned how important it is to have an existing culture, but maybe out of your experience, are there any recommendation or advices you can give mothers that are working in an environment that has not yet developed the culture of supporting mothers in breastfeeding? How can those mothers speak to their superior at the work about breastfeeding and their return to work?
Yeah,
Well,
I think that one. Oh,
sorry. I don't. Sorry.
No, go ahead.
Maybe first Oscar and then Josephine.
No, sorry. I think the question is for Josephine.
No, yeah, you can answer, Oscar. Go ahead. I think it's interesting to hear both.
Well, no, it's okay. I'm just going to say that a part of this question is when the mother when the mother doesn't have the support of the workplace. I think we have different laws in the world. We have treaties in the world. We need to support them because it's a right that they have just to be a mother, and we need to support this part, the laws. It's the comment that I was to say.
Thank you. Maybe Josephine, you can add something here on what is your advice for mothers working in an environment that does not yet have the breastfeeding culture? How should they speak about breastfeeding and their return to work?
I think that's very important, especially because it's also very common. You can imagine the women who work, for instance, in manufacturing, the factories where a majority are probably men. So it's not a culture where you live and talk about breastfeeding, but it's a conversation to definitely start during pregnancy before going on maternity leave, because maternity leave is already very well established as part of the law. So the other question is to ask, why is it that this provision about breastfeeding is not becoming commonplace conversation? So to start that conversation, even just with peers, because sometimes due to hierarchy and the work culture, the organizational culture that is very hierarchical. So to see which of your peers have been here the longest, which of your peers has more voice or agency than you do, how can they come and advocate for you? Which is why it's very important to have what we call breastfeeding champions or breastfeeding advocates. It doesn't have to be a woman, it can be a man. You know, do you have somebody who understands because they are a father? So they understand what it takes to give a woman support when she's breastfeeding. Can that conversation start during maternity leave? Do you have somebody there who can go to HR and say, oh, okay, listen, we have these women, most of them are childbearing age, we need to start making provisions. The law is there, so why are we not compliant with the law? So start looking at the barriers, because the law is there, so it's even supposed to be mandated. So now that conversation needs to start internally, but also with peers, because the more people who can come together, and both peers, male and female, and to say, you know what, this is benefiting me as a father, having a space or even having provisions that allow me to, if you can possibly work remotely, an organizational culture that supports you if your wife has had a child and they know that you might need more than the 2 weeks. So these provisions cut across, because that's why they're family-friendly policies or breastfeeding-friendly workplaces. But that conversation needs to start earlier, and it needs to start at all levels, and it needs to be supported from the bottom up.
Great, thank you. I think you already answered some question that we received about the role of men and fathers and breastfeeding, which, yeah, you just perfectly laid out. Thank you so much. We received some question around frameworks and legal legislations in general, maybe just shortly. International legislation, as far as I know, maybe Alice, you could then jump in afterwards. International legislation for workplace is mostly given by the International Labour Organization. It asks member states to provide a paid maternity leave for the first 14 weeks, and then extend this period by providing working breaks to provide time to lactate and or breastfeed while working. Regarding breastfeeding recommendation, there the state of the art is the WHO and UNICEF recommendation that recommends the initiation of breastfeeding within the first hour after birth, as well as exclusive breastfeeding for the first 6 months of the baby's life, and the continuous breastfeeding for at least until 2 years of age, and if wished for longer. Other questions maybe for Alice, are you aware of any framework that we can use to guide breastfeeding and its challenges?
Thank you. And I think I responded to that question on chat, and I said that the first conversation is to look at what is available in your country to start with. As you already mentioned, Kathrin, the international recommendations that countries normally adopt, and within your local ministries of health, you can start having these conversations and lobbying for developing frameworks that work within the laws of your country. It's also important to involve the civil society. It's important to involve people like Josephine, who are lactation specialists, health workers who actually know the benefits of breastfeeding. That is where you start the conversation from, because the frameworks exist from the international level that we can adopt and work from our countries. I think the other thing that I really liked what you've learned today is the discussion from Oscar that companies can actually promote breastfeeding. And I don't think the company is going at a loss. But I want to mention that I work for Amref International University, which is part of Amref Health Africa. Amref Health Africa has put a policy that supports breastfeeding for 6 months. And therefore, all the women who are in Amref, you get 6 months paid maternity leave. And that does not include your normal leave. So you can actually end up staying up to 7 months. In addition, we also provide breaks. You can now have a flexible working hours until 2 years. In addition, we have also provided lactation rooms. So it is really possible to support breastfeeding at all levels. And those are some of the frameworks that you can look at and start negotiating from where you're based. I didn't actually get where the presenter, the question, which country they came from. Thank you.
Thank you, Alice. I would now move on to a question that I would like to first ask to Oscar, but please feel free, Gabrielle and Josephine, to join in later. The question is, the workplace has become so competitive, and while women might want to exclusively breastfeed and continue breastfeeding for 24 months, it is sometimes difficult to catch up with our male counterparts. In some instances, women miss out on promotion, exposure to different work environments and locations, and so on. How do we support career growth for mothers during this breastfeeding period? Maybe Oscar, could you elaborate a bit more on how MABE is providing this career growth for breastfeeding mothers?
Yeah, thank you. Well, this is a very important question. I think it's an excellent point. The career growth doesn't need to be stopped by the breastfeeding. Yeah, so I think it's a part of the workplace to promote that these spaces. We have different programs with this. We have the nursing rooms to this, and we have some permissions for the mothers. We have different permissions, almost the 6 months leave or permission for the mother. But we have to another way when they finish these 6 months, they came to work again. So when they want to continue with the breastfeeding, not exclusively before this after 6 months, they have 1 hour a day to breastfeeding, and they have 1 hour extra to leave the job in early. Yeah, so they have more time with the child, and they have more time for family, but they have the time to think in the work or in the job. So they have the opportunity to continue growing in the company or in the workplace. So I think it's a good experience for all the women almost in MABE.
Great, thank you. Maybe Gabrielle, do you have any addition to this, or any insights from your experience?
Yeah, I would like to add that it's an important point, the worry of mothers about the career growth, because men are continuing at work and mothers stop it for months, 6 months. So I think it's a big change, a cultural change, but we need to bring this father to the maternity, to the paid leave, to the whole paid leave, to give more equity in the care of the child and in the company too, because this man will be off of the job for 4 months, equal the mother, and he will stay more closer to the development of their child, helping their mother, giving them a support to continue breastfeeding, and with this the mother and the father come back together. Men and women come back together for the job, at the workplace. So it would be more equal to think like that, both for the development and for the career too.
Great, thank you. Josephine, maybe same question to you. Have you any add-on experience from your work?
Yeah, I think we're still, I agree with Gabrielle in the sense that a mindset change as well, because not all women have to be, or all employees have to be in the office, and COVID taught us that. So the lessons that we learned on how to still remain productive and work from home should actually be translated to this space of maternity and paternity leave, which is why for me the emphasis is not just giving the fathers the 2 weeks of solid go home or paid leave, but also, as Gabrielle is saying, to be able to work remotely if you already can, or if you already were pre-COVID. So why not borrow other work practices in different industries where you can do remotely, work flexi, and a woman doesn't lose her place in the workforce. She doesn't lose her place on the career ladder because she's still productive. You know, the reason why we are asking for the month of closeness is because direct breastfeeding at the breast is more effective than even when you pump and when you feed with a cup or a bottle. So that mother being close to her baby protects her supply. But it doesn't mean it's a penalty for not being able to work. If I'm feeding my baby every 2 to 3 hours, it means every 2 to 3 hours, I'm free to do something else. I don't have to leave my baby and get onto a 1 hour commute to go sit in the office and do the same thing I would have done and sat at home. So I think it's a whole mindset change. It's a way of borrowing from different work cultures that are doing quite well. We are now global enterprises. We now have more innovation. So let us use that innovation to support the career mother.
Thank you, Josephine. I think, flexibility was the key here that I heard from all three of you. And I think that's a very insightful recommendation. Josephine, we received the question for you, and I would like to hand that over to you. The question was, what is the way forward on institutionalization and regularization of legal frameworks for baby and child daycare centers, and further so, licensing for accountability and safety of both the baby and the mother? Should there be at least one daycare center in every community unit?
Yes. So right now the issue is that the frameworks are not, the acts are not harmonized because the provisions have not been fully tweezed out. So every county is allowed to bring in whatever provisions they want. So they are there. For instance, Mombasa County and Nairobi County have Child Care Facility Acts. They're there. 2016 for Mombasa, 2017 for Nairobi, and different counties also have them. So those are the bigger cities that I'm mentioning. But what the government has realized, and they did that because there was a national care reform strategy. So it is in place for Kenya, because they realized that lack of harmonization also on the ground at informal settlement level is also going to mean that if you go to one community unit, as this person has said, they are doing it a different way. I go to a different community unit. So just to answer the question, yes, the government is aware of the fact that harmonization is not working. So they're trying to come up with a framework that is going to guide all counties on what is the bare minimum registration, training of daycare managers and their staff. And in that training, part of it is also going to be infant and young child feeding practices and everything else that needs to go there. So the county can definitely help. And I had said in my presentation, by also subsidizing, so that if you have a daycare center and you've met all the prerequisites, then you can get some amount of money so that you can be able to now put health and safety standards in place, that everything works very well. And yes, daycare centers should be available in every community unit, that are regulated and that where there's accountability. I think it should be the base standard, especially when both parents are working. They can't afford to hire somebody. If you're working with minimum wage, very few people in Kenya are even earning the minimum wage. So how you're not earning a minimum wage, how are you going to pay somebody to look after your child? So daycare centers are definitely one way of enabling parents, mothers, to go back to work, but to still know their children are being cared for.
Thank you. Maybe it's kind of a follow-up question, but we received quite a few questions around the informal sector. So maybe I just pick one as a substitute for all the questions we got around informal sector. And how can working mothers in informal sectors or jobs be assisted? The maternal policy, like it is in Malawi and I guess in many other countries as well, only apply to mothers working in the government sector or the formal sector. Maybe, Josephine, do you want to start? And I would like then to hand it over to Gabrielle.
Okay, and it's a very big question, because one of the things for me, one of the recommendations for me was also to put, because we have a social protection policy and program, cash transfer. It's called Inua Jamii, meaning uplift the family. And it's mainly directed at children, if orphans, people living with disabilities, so they get benefits, so to speak. Internationally, the language would be benefits. But doing the same also for impoverished parents. Why aren't they able to also be put on the same program, where if you earn a certain amount of pay, if you earn below that pay, you're also getting cash transfers until you get a job? So working family benefits, but most importantly, that paid maternity leave that we're talking about, that's why it only applies to formal sector, because those are the ones with that contract saying you'll go on leave for 3 months and then we'll pay you for those 3 months. But I think it's something that the government should also do, because you cannot send out the message of exclusive breastfeeding for 6 months. The data is showing you it's not working. But one of the problems is that people need to earn a living, people need to survive. So if at least for maternity, for the 3 months, the government can also put those mothers or those parents on that Inua Jamii program, then we are one step closer to synchronizing the messages we are putting out there and the practical social protection that we are also giving. So I think for me, that we need to start somewhere, and that would be it. In addition to now the counseling, you walk into a facility, a free facility, health facility, and immediately you can find a counselor there. And this is for the informal sector mothers who need to be taught how to express, who need to understand. Maybe that facility can also have a fridge in that community unit. So the mother expresses, she leaves her milk there, well labeled, on her way home. She passes by the facility, she picks up her milk, she goes home. So again, partnering and seeing what practical solutions that we are placing in the formal sector, can we now bring that into the informal sector supported by the government?
Okay, thank you. Gabrielle, do you have any insights or experience from Brazil that could shed some light into how to support informally working mothers?
First, I agree with all the speech of Josephine. It's really similar to what I think, to what I'm seeing here in Brazil. And that's it. We need to press government to look at those women working in informal jobs, especially in countries like Brazil that have a great number of the women working this way. So we need to urgent need to look at this.
Great. Thank you. I think we got some more questions, but I thank you again for sending all those questions. I think we were able to cover most of them. Please bear in mind with us if we did not. Please send us your questions and we will send them to our experts to get you to those answers that you had. We would like now to move on and slowly wrap up our seminar and webinar. We do not want to take your entire evening or morning, wherever you are. So we will move on, but again, thank you for sending all the questions you had. They were wonderful questions, and if we could not answer them, please bear with us. So I would like to hand over to Alice for some closing remarks on today's webinar.
Thank you very much, Kathrin. Thank you, everyone. We have had a fantastic discussion. I want to appreciate all of you. We've had quite so many people from 98 countries engaged. If you look at the chat, we have not even been able to address all the comments. This just means that people really appreciate the importance of this webinar and, importantly, breastfeeding. Colleagues, we have had a very interactive session. We have learned from different regions, all the way from Kenya, Brazil, Mexico, and the team that is leading us from the UK, I think from the Global Health Network, from Lactation Hub. Thank you all for making this possible. Listening to all the presentations, we have learned a lot. And before I give even some of the key points that I've picked up from this webinar, I just want to emphasize the importance of supporting breastfeeding. Teaching in a university, I remember having one of my students requiring to have a baby. I advised the student to take maternity leave and breastfeed. But the following semester, the student came back, and I was very sad to see her, and I requested her, why are you back? Just go back and complete your stay with the baby and breastfeed as much as possible. And she told me, no, my mother said that I need to come back to school, and advised the health worker to give me an injection so that I don't have to breastfeed. So colleagues, I feel that as health workers, we have a very important role to promote breastfeeding, such that if we get young people who find themselves in such positions whereby they have to choose between breastfeeding and probably school, if I feel that if we give the right support, then we will not be having such situations. If we can go to the last slide. Today, we have learned so many things, and listening to the presentations from different countries, we note that there is a lot of work that has to be done for us to meet the WHO 2030 targets. The 2030 targets, we aim to ensure that more mothers are able to breastfeed exclusively. We have more protected maternity leave, and this information is out there. We have also learned from different countries, and we have seen that a multi-level, multi-sectoral approach is really important. Mothers are all working mothers, whether you are in paid employment, whether you are at home, you are a working mother. And therefore, support at home, support from family members becomes really important. Childcare facilities, because people have different settings, provision of childcare facilities, whether it is to the low-income mothers, becomes really another important thing to support breastfeeding. Training institutions need to strengthen their curriculums such that health workers are adequately informed to promote breastfeeding, to address the challenges that come about from breastfeeding, and even to lobby for policies that support breastfeeding at different settings. One thing I also picked is the model from Brazil of LactaHub. We learned that LactaHub means different things. LactaHub meaning discuss, and I could have missed some of those, the definitions of those, but it is in our notes, whereby it is possible to promote breastfeeding by listening, talking about it, and really allowing the mother to make the best decision. So therefore, as we come to the end of this webinar, colleagues, I want us to close this webinar by ensuring that we promote breastfeeding. Let's make breastfeeding and work. And we have learned that it is possible. We have seen the model from the company that Oscar has presented, whereby they have gone really steps ahead, including providing facilities at work, ensuring that the fears that mothers have about promotion while they're away are addressed, because we would not really want to have a situation whereby a mother has to choose between promotion and breastfeeding. Therefore, it is possible to make breastfeeding and work. Thank you all, and have a good day, a good evening, and a good night, depending on which part of the world you are in. I hand back to Kathrin.
Thank you, Alice, for this wonderful wrap up of today's webinar. Lastly, I would like to remind all of you about the certificates of attendance. If you would like to get such a certificate, please visit the LactaHub.org website, go to certificates, provide all your personal information that you ask for, and help us to make the next webinar even better by responding to those 2 questions. It was my sincere pleasure to guide you through those very, very informative and educative 2 hours that we had. Once again, I sincerely thank Dr. Alice Lakati of the Amref International University for hosting this webinar today. And a very warm welcome, a very warm thank you, of course. Thank you so much to our 3 experts, to Josephine Munene, Gabrielle Sauini, and Oscar Rojas. You made this webinar so informative today. Thank you so much. And thank you all the participants to take your time to listen to us. We hope you learned a ton, such as I did today. And we look forward to see you back for the next LactaWebinar. Thank you so much.